Okay, that's fine. So I'll be walking you through pre-exposure prophylaxis in HIV and then pre-exposure prophylaxis in viral hepatitis B. So as the name implies, pre-exposure prophylaxis, they are biomedical intervention that is given before exposure to HIV. So let's start with HIV. Now, these drugs, or rather the pre-exposure prophylactics, can come in form of pills and they can come in form of injections. So let's talk about the pill. The common drugs we use for the pills, they are the entrecitibine and then the tenofovir disoprasine fumarate. These are the two drugs we use for the pills. And then when you talk about the injectable pre-exposure prophylactics, we talk about the cabotegravir. It's an injectable form. So the injectable form is given after every 2 months. So you can take the injection now. You will be protected for the next 2 months. The 2 month injection confers protection for 2 months. So cabotegravir confers protection for 2 months. Now the injectable part, this is how to take it. Assuming, although it is taken for those at risk of HIV infection, for example, discordant couples where a partner is positive. So in such a case, assuming you want to meet a partner who is positive, 2 to 24 hours before exposure, 2 tablets of these drugs are taken. And then after meeting the person, 24 hours after meeting the person, 1 tablet is taken, and then the last tablet is taken after another 24 hours. So with that, you'll be conferred protection from HIV and AIDS. Now, a situation where consummation becomes a continuous process, this drug should be taken after every 24 hours. Now let's talk about the post-exposure prophylaxis, which happens after exposure. Meanwhile, be it pre-exposure prophylaxis or post-exposure prophylaxis, it must all happen within the negative window period. You must be negative before you take the pre-exposure prophylaxis. You must be negative before you are given the post-exposure prophylaxis. So let's talk about the post-exposure prophylaxis. What we give in post-exposure prophylaxis, they are the entrecitibine, the tenofovir disoprasine fumarate, and then the dolutegravir. These are the 3 drugs we take or we give to people that are, that have come in contact with the HIV virus, but they are still negative. Now, it is a known fact that tenofovir disoprasine fumarate is nephrotoxic. It affects the kidneys. So people that have renal problem or with low, hepatic clearance, a lower dose of the tenofovir is given. In this case, we give the tenofovir alafenamide in addition to entrecitibine and then to dolutegravir. Now, there are some people that cannot tolerate the tenofovir at all. So tenofovir can be substituted for abacavir 600 milligrams, taking one daily in addition to your lamivudine and then to the dolutegravir. Now, there are some people that cannot tolerate tenofovir, they cannot tolerate abacavir. So such people we give the duranavir and then the ritonavir. These are the 2 drugs we give in such a case. So we've talked about pre-exposure and post-exposure prophylaxis in HIV essentially, and we've named the drugs and how they should be taken. And then, like I said, you have to monitor the kidney function and then the liver function to see how your body reacts to it. Otherwise, drugs can be switched at any time. That being said, let's jump right into viral hepatitis B. Viral hepatitis B pre-exposure prophylaxis is just essentially the hepatitis B vaccine. This vaccine can only be given to those that are hepatitis B negative. Now, the schedules of the vaccine can come in 2 forms. It can be the 012 schedules or 016 schedules. What it means is that you can take the hepatitis B vaccine today, after 1 month you take, and then after the other month you take. So within 3 months, you can complete the full course of the vaccine and you'll be protected for greater than a decade. And then we talk about the 016 schedules, where just like the first one, you take the first dose at the start dose. Then after 1 month, you take the other one. And then after about 6 months, you take it. Whichever one, the protection will be there for more than a decade. So that is that about the pre-exposure in viral hepatitis B. Now let's talk about the post-exposure. If you are not vaccinated and you accidentally come in contact with the hepatitis B virus, either in the hospital setting or anywhere, the post-exposure prophylaxis comes handy. And what we give essentially is the hepatitis B immunoglobulin and then the hepatitis B virus. They are given immediately within 24 hours of coming in contact with it. However, it can equally be given, within 48 or even 72 hours. It depends on your immune system and then the exposure to the virus. That's the key thing. So hepatitis B immunoglobulin comes in different strengths. You can have it in 100 IU per ml, 200 IU per ml, 312 IU per ml, 500 IU per ml in different strengths. What that implies is that what we give depends on the weight of the baby. For example, like the hepatitis B immunoglobulin is given sometimes or most times is given to a seronegative or seropositive mother who has just given birth to a seronegative baby. So in such a case, this vaccine is given to the baby, the hepatitis immunoglobulin, and then the hepatitis B virus given to the baby to neutralize any effect, any accidental effect of this virus in the baby. So once that is given, breastfeeding can start immediately. There is no point deferring breastfeeding if a seropositive mother, gives birth to a baby that is negative. Again, these days we are, talking less on the hepatitis B immunoglobulin because of the costs and because of, the harsh economic reality. Breastfeeding can equally continue after the first dose of the hepatitis B vaccine, even without the immunoglobulin. But breastfeeding can continue. That is for mothers that are seropositive to hepatitis B. But as an adult coming in contact with the virus, I've told you you need hepatitis B immunoglobulin and then the hepatitis B virus injection immediately. And after that, the full course of the vaccine, should be continued. Like either you adopt the 012 schedules or the 016 schedules. So today, we've talked about pre-exposure prophylaxis in HIV, post-exposure prophylaxis in HIV, and then we've equally talked about post or pre-exposure prophylaxis in hepatitis B and post-exposure prophylaxis in hepatitis B. Thank you.